So I'm just going to touch on healthy eating. If you come through the program, the dietitian will get into very specific things related to this. Suggestions for menus and what's good and what's not good. And they'll go over your food log if you record one, and she'll tell you if you're making any mistakes. But in general, obviously we want to decrease portion size. That's what the balloon, the major efficacy of the balloon is to help decrease portion size by making the person feel full, and that should help decrease calories. We always want prefer a patient be on a low sugar, low fat diet. We like to also keep in mind the glycemic index. You probably heard this if you've been watching TV, and I forget which company it is. There's always talking about the glycemic index, but it's the degree of how quickly the blood sugar rises after you eat a carbohydrate, basically. So if you eat a carbohydrate where the blood sugar rises very quickly, there's a very quick insulin response, and that does a couple of things. It can lead to rebound hunger, and it can lead to switching on the fat deposition chemical pathways. So we want to avoid the blood sugar bouncing up and down a lot. So we want to stay with low glycemic index carbohydrates. That tends to be the more natural carbohydrates, like fruits and vegetables. Avoid saturated fat. That's probably just a good idea in general from a atherosclerosis standpoint. There are good fats and bad fats. The omegas are the good fats, and the saturated fat and trans fats, which are hardly anything anymore, are the bad fats. Protein should be about 30% of the total calories. It's probably a good idea to avoid processed foods. Anything that comes in a cellophane wrapper is probably not very healthy for you. So we want to try to avoid those things. And we also want to be aware of calorie density. We were talking about that before we got started here. That's the ratio of the calories to the weight of what you're eating. And there's a really good book called Volumetrics by a PhD from Penn State. Volumetrics. Barbara Rolls is her name. Where she talks about that and how to feel full with fewer calories. And it has to do with calorie density, not total calories of what you're eating. And I think that's very helpful it's going to be helpful with the balloon patients, certainly very helpful with the sleeve patients and the band patients, everyone else with a restricted volume.